joining Santera Health Plans for another episode of Audio on the Go. I'm Kira Kuhn, a health educator with Santera Health Plans and Preventive Services Department. Our Audio on the Go episodes are designed so you don't need to be sitting in front of your computer to watch, but rather you can listen while you get up, stretch, walk, and move. So we invite you to do just that. Today, we are discussing well-being in aging, and it's the perfect time because September is Healthy Aging Month, in which we highlight and promote ways people can stay healthy as they age. And if you're thinking, this doesn't apply to me just yet, I have news for you. Healthy aging begins early in life. Healthy living is healthy aging. As we get older, our bodies change and our minds change. Maintaining a healthy lifestyle in all aspects of well being and from a young age can help us through those changes and can help prevent some common age related health concerns. Now, of course, there are so many factors that influence healthy aging. Some of these are not in our control. Think genetics. But other factors are definitely within our sphere of influence, basically, how we take care of ourselves. Today, we are mainly going to explore things you can do to help manage your health, live as independently as possible, and maintain your quality of life as you age. I'll be referencing information from the National Institute on Aging, which for the past 50 years has been the leading organization researching the nature of aging and how to extend the healthy, active years of our lives. Okay, so we are going to break down how you support your own well being in three different areas: physical, mental, and cognitive. These overlap, so you will see how taking care of yourself in one area will help you care for yourself in the others. Let's dive right in to your physical health. Physical activity has been called a cornerstone of healthy aging. Study after study tells us that people who move more not only live longer, but may also live better, meaning they enjoy more years of life without pain or disability. Moving every day reduces risk of death from all causes. It is no secret that exercise is an essential tool for maintaining a healthy weight, which decreases your risk of death, disability, and many diseases. However, it is important to note that thinner is not always healthier either. Being or becoming too thin as an older adult may weaken your immune system, increase the risk of bone fractures, and in some cases may even be a symptom of disease. Both obesity and underweight conditions can lead to loss of muscle mass, which may cause a person to feel weak and easily tired. Now, as people age, muscle function often declines, and this is because we naturally do lose muscle mass as we get older. This is a condition called sarcopenia, and it occurs in everyone over time. The best way to limit the extent of loss of muscle strength is by staying physically active. A combination of aerobic and strength training exercises will improve muscle health as well as overall health. In addition to helping older adults live better, maintaining muscle mass can help them live longer. Okay, moving from muscles to bones. As you age, you begin to lose more bone than you form, which raises the risk of osteoporosis, a disease that weakens your bone. Half of all women and a quarter of all men over the age of 50 will actually break a bone at some point due to osteoporosis. Guess what can help maintain your bone density? You guessed it, exercise. Like your muscles, your bones also respond to exercise by becoming stronger. The best exercise for your bones is weight-bearing activity such as walking and lifting weights. As with exercise, eating well is not just about your weight, it's so much more than that. The dietary guidelines suggest an eating pattern with lots of fresh fruits and vegetables, whole grains, healthy fats, and lean proteins that can help protect you from certain health problems as you age and may even improve brain function. We've already talked about maintaining muscle mass, bone density, and exercise in general. To build muscle, eating protein-rich foods is key. Vary your protein choices with more fish, beans, and peas, or low or fat-free dairy fortified with vitamin D. To slow down bone loss, an anti-inflammatory diet which is rich in vegetables, fruits, fish, nuts, and whole grains is important. This type of eating pattern is high in protein, calcium, and micronutrients such as vitamin K, and magnesium, all of which are key to maintain bone health. Now, protein and calcium are critical, but you also need carbohydrates, which is the energy source your body uses to be able to exercise. Middle and older adults should generally not be on a low carbohydrate diet, but be sure to choose healthy carbohydrates like vegetables, fruits, and whole grains, which are preferable to the highly processed foods. Whole, fresh foods also have vitamins and other nutrients your body needs. So, three general eating patterns that I want to point out that have been shown to have a positive impact on health. The Mediterranean style eating pattern, it emphasizes fresh produce, fish, whole grains, healthy fats, and less dairy than a traditional American diet. Those that follow a Mediterranean style eating pattern have been shown to have a significantly lower risk of sudden cardiac death. Next, the DASH diet, which stands for Dietary Approaches to Stop Hypertension, DASH. It's a low salt diet, and it has been shown to lower blood pressure, help people lose weight, and reduce the risk of type 2 diabetes and heart disease. And now the MIND diet. This one actually combines a Mediterranean style eating pattern with DASH. And researchers have found that people who closely follow the MIND diet have better overall cognition, that ability to clearly think, learn, and remember, compared to those with other eating styles. The MIND diet limits red meats, dairy, and processed foods and focuses instead on vegetables, especially green leafy vegetables, nuts, berries, beans, whole grains, poultry, fish. These foods are rich in nutrients, antioxidants, and omega-3 fatty acids that are strongly associated with brain health. What is nice about the MIND diet is that even moderate adherence to the diet can significantly reduce your risk of dementia. So, incorporating even a part of these eating patterns, such as more fish or more leafy greens, into your daily eating habits can improve outcomes. When we're talking about diet, let's not forget about a simple tip that is so often overlooked by older adults: drinking water. As you get older, your sense of thirst changes, and you may not notice that you need a drink of water like you once did. Some medications and health problems may also make it harder to get enough fluids and can lead to dehydration. Dehydration can cause a number of health problems. To name a few: poor memory and concentration, fatigue, weakness, increase in falls, skin conditions, urinary tract infections, kidney problems, and constipation. Moving on to sleep. Getting enough sleep helps you stay healthy and alert. That's across the board, no matter our age, right? From newborns to older adults. Even though older adults need the same 7 to 9 hours of sleep as all adults, they often don't get enough. If you aren't feeling well or you are in discomfort or pain, this can make it harder to sleep. Some medications can also keep you awake, but not getting enough quality sleep can make a person irritable, depressed, forgetful, and more likely to have falls or other accidents. Studies have found that those who had poor sleep quality had a harder time problem solving and concentrating than those who got good quality sleep. Another study showed that those living in their 50s and 60s who got 6 hours of sleep or less a night were at a higher risk of developing dementia later on in life. Good sleep can also improve your creativity and decision-making skills, and it's associated with decreased depression, lower rates of insulin resistance, heart disease, and obesity. There are many things you can do to help you sleep better, such as following a regular sleep schedule. Try to fall asleep and get up at the same time each day. Avoid napping late in the day, as this may keep you awake at night. Exercise can help you sleep better too if it isn't too close to your bedtime. And behavioral interventions, such as mindfulness meditation, can also improve sleep quality. You can check out some of the meditation resources available at centerahealthplans.com/mylifemyplan. Moving on to quitting smoking. It is never too late to quit. We know that even if you're 60 or older and have been smoking for decades, quitting may be the best single thing you can do to improve your health. Quitting smoking at any age will lower your risk of cancer, heart attack, stroke, lung disease, and osteoporosis, improve your blood circulation, improve your sense of taste and smell, and increase your ability to exercise. If you or a loved one are ready to quit smoking, check out CenteraHealthPlans.com/quit smoking or call the state quit line at 1-800-QUIT-NOW. Alcohol consumption. Like all adults, it is important for older adults to be aware of their alcohol consumption. Alcohol dependence or heavy drinking affects every organ in the body, including the brain. Evidence has been shown that certain brain regions actually show signs of premature aging in alcohol dependent men and women. How the body handles alcohol also changes with age. Some older people may feel the effects of alcohol more strongly without even increasing the amount that they drink. This can make them more likely to have accidents such as falls, fractures, and car crashes. In fact, aging can lead to social and physical changes that make older adults more susceptible to alcohol misuse and abuse and more vulnerable to the consequences of alcohol. As we age, alcohol consumption can make existing health problems worse and have dangerous interactions with some medications. Many older adults take medications every day, making this a particular concern. So before taking any medicine, ask your doctor or pharmacist if you can safely drink any alcohol at all while taking it. Visit your healthcare provider for regular health screenings is essential for healthy aging. Regular checkups help doctors catch chronic diseases early and can help patients reduce risk factors for disease. Harmful changes in the cells and molecules of your body may occur years before you start to experience any symptoms of disease. But tests that detect these changes can help the disease to be diagnosed and treated early, improving health outcomes. If you only seek medical attention when you're experiencing symptoms, you may lose the chance of having your doctor catch a disease in its earliest stages, when it would be most treatable. So visit your primary care provider at least annually, and more is needed, and follow recommendations for screenings based on your age, sex, and family history. These can include bone density scans, certain cancer screenings, blood pressure checks, and more. Visiting your PCP can also help you stay up to date on vaccinations, such as shingles, pneumococcal vaccine, and your flu and COVID vaccinations. Okay, moving on to mental health or mental well being is essential to your overall health and quality of life. It affects how we think, feel, act, make choices, and relate to others. As people age, changes such as hearing and vision loss, memory loss, disability, trouble getting around, and the loss of family and friends can make it difficult to maintain social connections. This makes older adults more likely to be socially isolated or to feel lonely, and that puts them at higher risk for several chronic health conditions, including depression and cognitive decline. But staying socially active also has big benefits. Staying connected with others or making new social contacts is associated with improved self reported physical and psychological well being. Those who have regular contact with friends and family are also found to be more physically active than those who are not. Stress. Researchers have found that levels of the stress hormone cortisol increases steadily after middle age, and that this age related increase in stress may drive changes in the brain that can impact memory, decision making, and mood. So you want to manage that stress. A good way to do that is to participate in activities that you enjoy, perhaps a new hobby that you didn't have time for in other phases of your life. Reaching out to friends and family and staying connected can also help. Depression. Although depression is common in older adults, it can be difficult to recognize. For some older adults with depression, sadness is not their main symptom. Instead, they might feel numb or uninterested in activities, and they may not be as willing to talk about their feelings. Depression not only affects mental health, but also physical health. The lack of sleep and loss of appetite are common symptoms, and we already talked about the important role that both of those play as you age. Depression increases the risk of heart disease and metabolic disorders, as well as dementia. Scientists found a relationship between the number of depressive episodes and increased risk of developing Alzheimer's. Now, depression, even when severe, can be treated. As soon as you begin noticing signs, it's important to get evaluated by a healthcare professional. If you think you or a loved one may have depression, start by making an appointment to see your doctor or healthcare provider. And if you or a loved one are in crisis, you can reach the 24-hour Suicide and Crisis Lifeline by dialing 988. Although different than depression, which is a serious medical disorder, mood changes can also influence aging. Research shows that whether you hold negative or positive views about aging may impact health as you age, including biomarkers for dementia. Cognition, which is the ability to think, to clearly think, to learn, to remember, often changes as we age. Although some people develop Alzheimer's or other types of dementia, many older adults experience more modest changes in memory and thinking. Research shows that healthy eating, staying active, and learning new skills may help keep older adults cognitively healthy. National Institutes of Health, NIH, has raised 5 healthy lifestyle factors as having important cognitive health benefits. They are at least 150 minutes per week of moderate to vigorous intensity physical activity, not smoking, not drinking heavily, eating a high quality Mediterranean style diet, and engaging in mentally stimulating activities such as reading, writing letters, and playing games. In fact, research has shown that those who followed at least 4 of those healthy lifestyle behaviors had a 60% lower risk of developing Alzheimer's. Even practicing just 2 to 3 of those behaviors lowered the risk by over a third. So, while results from studies like these cannot prove cause and effect, they do point to how a combination of positive behaviors may lessen Alzheimer's risk. So, I hope that you are on board with seeing how taking care of your physical, mental, and cognitive health is important for healthy aging. I've thrown out a lot of information, but if you just walk away with the following, you'll have what you need to know. You can support your physical health by staying active, eating and sleeping well, managing stress, and going to the doctor regularly. Take care of your mental health by interacting with family and friends, staying positive, and participating in activities you enjoy. These things that you do in taking steps to achieve better physical and mental health can improve your cognitive health. So it is all connected, and even making small changes in your daily life can help you live longer and better. So I'd like to end with the many positives of these golden years. There is so much. To name just a few benefits of being an older adult: wisdom and perspective, grandchildren, more time for loved ones, opportunity to pursue your dreams, participation in civics and volunteering, better social skills and more empathy, senior discounts, sense of accomplishment. I thank you for taking the time today to focus on your well being. I wish you wellness in all the years of your life.